Welcome in, everybody. My name is Dr. Tim Brown, as always, hosting Farmcast for the community. Actually, this has been going on for about a year now. We continue to grow in popularity and people coming on board, and we continue to expand topics. Many of you may not realize that we started out really doing a COVID kind of aspect to talk to the community and tell them what's going on. We've turned that around, and we've been highlighting a lot of different aspects over the past year when it comes to what pharmacists are doing in your community, but also how they're impacting your healthcare overall. And next month, I'm going to bring on a certain person that works in the community who's going to talk about allergy medications. And I'll talk about that near the end of this podcast, and we'll sort of tease it a little bit, him coming on board, but that takes nothing away from the guest we have on today. Dr. Ashley London is coming in for us and having a discussion today about what we call Take Back Medication Day. And we're going to walk our way through that a little bit. Dr. London graduated from UGA in 2005 and then Mercer University College of Pharmacy in 2009. And Dr. London, where are you currently working?
Currently, I'm at Barney's Pharmacy in Augusta, Georgia.
Wonderful. And you're the pharmacy manager there, correct?
Yes.
So you are the woman in charge.
Yeah, that's what they call me.
I love it. Thanks so much for agreeing to come on and talk about this, because I know Barney's and several other community pharmacies take a great pride in serving the communities around them. And if I'm not mistaken, Barney's has several stores in around the Augusta area. Is that true?
Yep. We got 8 stores in the CSRA. We're a family-owned and operated independent pharmacy. We do anything from the regular prescription medicines. We do compounding. We do specialty medicines, medical supplies. So like wheelchairs, big equipment, then smaller stuff like ostomy supplies and wound care. So pretty much a one-stop shop.
You do a lot then. So you have medical supplies for people, medications. Obviously, you have a storefront where you have some items out there that you can buy over the counter for certain things too. Is that, yeah?
Mm-hmm.
Yeah.
Yeah.
So is it a big store? It must be huge.
The main store is huge. So that's where I'm at. We have a classroom where we can do support groups and wellness classes. We've got a big showroom of all the big equipment. And then we house both our regular pharmacy and then also a long-term care pharmacy, which specializes in adherence packaging. So like the bubble packs, the blister packs, those kinds of things.
Wow. So you have a chance to interact with people coming in for all different sorts of things, not just I shouldn't say not just, because that's not true, but, coming in for a medication, I think people go, oh, pharmacy, medication, pharmacist helps with that. But you're helping with everything from people figuring out how to organize their medications all the way to helping them get devices and such so they can have a good quality of life.
Yep.
Wow. That's cool as heck though, right?
Yeah. There's a huge team of people, so it's not just me.
Sure. Yeah. I get it. You're not the only person in the store, but I think it's wonderful you have that team and that sort of, I'll call it the holistic approach, where you're looking at every aspect of the person's life. It's not simply saying, here's your blood pressure medication. It's talking to them about various things. How many patients or people do you see in a given day coming into your store?
We probably interact with 400 patients a day.
Wow.
We do all those things. We also make about 100 deliveries a day. So that's pretty exceptional. So it may not even be in person. We have a lot of relationships over the phone. We may never see them, but we know all about them.
Right. And do you spend some of that time when you're with them? I mean, obviously they're coming in the door to get their medications or their supplies or this or that, but do you spend time talking to them about their health care, and do they have questions for you a lot of times?
Yeah. I feel like we thrive on our customer service. So where other pharmacies may not be able to provide a service, we step in.
So when you say step in though, give me an example. I mean, I have not been in a community pharmacy since I was starting in my career. So since that time, community pharmacy has grown not only in what we do, but also what we can do legally, like what the boards of pharmacy allow various pharmacists to do. When I was doing it, you dispense medication, you counseled a little bit. Now it's so far beyond that. You do so much more than, yeah, we help out. You're being modest.
We've seen quite a few patients come to us. Maybe their pharmacy closed. Maybe they can't, they depend on deliveries. And they'll come in, transfer prescriptions, maybe 20, 30 medications. So I like getting those patients going through their profile, finding what they actually take. Sometimes you can take them off the medicine. Sometimes you can save them some money. Sometimes you can tell them a certain time of day to take it, so it helps them remember to take their medicines. Sometimes we'll sign them up for our sync program or adherence packaging. So those kind of services you may not get everywhere else, and it brings them here, and we're able to have those good conversations and get to know them and help them with their medicines.
I like that a lot. I mean, as I age, I don't take a lot of medications, but there are days I simply forget to take a medication. So that programming to help me remember, I love that idea of sort of putting helping them, a bug in their ear, if you will, to help them do things.
Mm-hmm.
You mentioned that you do a lot of services. One of the hottest topics right now, I mean, it is burning up, are vaccines, not just the COVID vaccine, which I understand people are talking about, but just access in general. I mean, no one wants to, I shouldn't say no one, but it's hard to sit in a waiting area and be around people. And it seems like the pharmacies have really risen to the challenge with making it accessible for people to get vaccines. Do you guys also do vaccines at Barney's?
Yeah, I think we started doing vaccines before I was here, so over 10 years ago. That's just basically the flu vaccine. And then as the state protocol has allowed us, we've started doing pneumonia, shingles. Those are the main ones that we do. And then you can also get them without a prescription. We have our own travel vaccine program here,
Wow.
that we have a lot of military people going overseas or other travel things that we're able to help patients with. Just excited about more opportunities with that.
So you have a lot of folks who come in there and get their annual flu shot. Then they come in for their booster shots for like their pneumonia, depending on how old they are. And then their shingle shot is now a 2-shot series. So you do that too. And then have you also rolled out, like as everything has changed, have you also rolled out COVID vaccinations, or the 2 to 3 vaccines that are now available to the public?
Yeah, we were, I think, one of the first providers in Georgia to do it. We started doing Moderna back in December.
Wow.
And it has been a roller coaster ever since. We're doing anywhere from 30 to 50 appointments a day, getting people from all around Georgia. Right now, we're getting a lot more just in our community, making sure we can get everybody vaccinated and back to normal. And that's been very exciting to be a part of that.
I bet. And also seeing that sort of sigh of relief for some people to say, okay, I've got my first dose. I'm on my way here. So, okay. So you guys talked about Moderna. I'm assuming you also have the other vaccines available now too.
We don't do Pfizer just because of storage conditions.
Got it.
And then we did receive Johnson & Johnson, and we are currently just storing that and waiting on the pause until we are able to give it again.
Until they talk about, yeah. So that's important for people to understand that some pharmacies may not be able to carry Pfizer because you have to store it at such a low temperature that Moderna is going to be their option when they come to your place. So it does change a little bit because of the way you store those things, because it's like a sub freeze for one of them and the other is refrigeration, right?
Yeah, Moderna, we actually keep in a freezer, a special freezer, but it's not a sub-zero freezer.
Got it. I understand.
And Johnson & Johnson can go on a regular refrigerator. So that's going to be probably our most common vaccine once it's, hopefully the data's there for, to be able to give it again.
Exactly. And that's the 1-shot one, the last one that came out. Yeah. I love the fact that you guys sort of have sort of a vaccine stop, if you will, for people who are coming in the door. Also, it sounds like accessibility. It'd be easy to come in the door and set that up an appointment. Do you do an appointment or just people walk in for vaccines?
We try to do appointment based, and that was something we started before COVID, just to make sure that patients weren't waiting a long time, that we had the vaccine in stock. But especially with Moderna, you've got 10 doses out of a vial and you have to give them in a certain amount of time. And then we want to make sure that we don't have 10 people at the same time. We still want to maintain that social distancing and make sure our patients are safe. So we have an online appointment scheduler. And then we have some patients that if somebody cancels, that we can give a call to and have them come.
So you really thought this out. So when those people are there and they're in line, they're doing this and that, do they also have other questions about their medications? I mean, they've got your ear as the pharmacist. Do they take advantage of it and ask you other questions while they're there?
Yeah, I think vaccine giving is probably the best time we've had in a long time to get out and talk to patients about their medicines, about over-the-counter stuff, about anything. So that's been very rewarding, just to have a few minutes one-on-one with patients.
Very nice. So when you talk about medications beyond vaccines with your patients, what do you guys talk about? What are some of the most common questions that people walk in and want to ask the pharmacist?
I say mostly, side effects. What can they expect? How long is it going to take to work? Can you take this with that?
Good questions, right? I mean, kind of things I'd want to know is this going to cause me to have an upset stomach because I'm getting ready to go on this trip tomorrow and I don't want to get on the airplane? These are good questions to ask before you start a medication.
Yeah.
That
It's
see,
all
I love that they have people in the community who can talk to them about that. Do they ever talk about? I'll be more than blunt. I, you ever have that bag of medicines that you have in your cupboard, and you're like, okay, I have my Tylenol, I have this, I have that, and a year later that bag is still sitting there. Do you ever have people sort of look at you and go, okay, I have all these extra medications that they're expired. The bottle says this. I got them from my grandparents after they passed away.
Mhm.
Do they ever say, what the heck do I do with this?
Yeah, that is a super common question, and we have figured out different ways to handle it. But so we have a drug drop box in the store where it's kind of like a mailbox, and you can dump your medicines in there. And I encourage patients, if you have old medicine, you switch to dose so you don't get confused. If you're starting a new like medication sync program, that you can come and get rid of them. So
That's smart. That like even if you have multiple, like I'll think warfarin, Coumadin, where you can be given a lot of different dosages, and finally they get you on one you want. You can get rid of the other dosages if you can't use them, because you could end up making a
mhm.
mistake and taking the wrong one, the wrong
Oh yeah,
dose.
yeah. I mean, anything, blood pressure, any of those things.
Huh.
And some
So
people stockpile their.
yeah, I was going to ask about the stockpile. My mother was notorious for going to the physician, having an infection, and then getting some antibiotics. And she would come home and she would take half of them and give the other half to my dad just in case he caught what she had. And it took me forever to go, no, no, mom, no, you need to take the whole course. I'm going to bet you there's some people who stockpile and have like antibiotics lying around. What should we do? I mean, when do they no longer work, basically?
So every time you get a bottle from the pharmacy, it's going to have an expiration date on there. It's going to be a year from now. And based on how you store it, if it's in your bathroom with moisture, it may not even be good for that year. So at minimum, you want to get rid of them after a year. If it's something you no longer take or need, antibiotics that you're not going to have a full course of therapy, you want to just get rid of them. It's going to be confusing. People can get into your medicine. It's not good to have in the house.
Yeah, that's a good point. I think people go, but I paid a copay for that, or I did this, and man, I get it. But you made a really good point. If you store your medicines in the old medicine cabinet in the bathroom, when you shower, take a bath, wash all that moisture, that breaks down it gets in those bottles, right? And breaks the medication down. You just don't see it.
Yeah. It's really not good to keep your medicines in the bathroom like that.
Yeah, I've been taught that you never put it over the refrigerator and never put it in the bathroom, because both of those have heat and it will
Mm-hmm.
cause the medication to lose their potency. It won't work as well.
Yep.
So cool, dry place at room temperature usually, but only those that are active, like the ones you should be taking. Your point about cleaning out the cupboard, I think when we talk about antibiotics, it's like, well, what do I do with it? Like it's a Tuesday, it's
Mm-hmm.
June 3rd. I'm like, well, I think today I'm gonna do some cleaning. How would I get rid of, say, an antibiotic or a blood pressure medication, something that I no longer use, it's been discontinued? How do I get rid of it? Are there rules?
So yes and no. Some ways you can do it at home would be mix it in with like kitty litter or coffee grounds to get rid of it right away. But coming up later this month, there is a National Drug Take Back Day on April 24th. So you can return it to one of those places that's hosting it. So it's commonly at sheriff's departments and some pharmacies.
And you said you have a drop box in your store all the time.
Yes. So you can access that anytime that we're open. And you can return tablets, capsules, just pretty much not liquids, inhalers, or syringes, because that's not safe to put in there.
Got it. So the one thing you mentioned is the Take Back Drugs Day. What is that? What it's called? Take Back Day?
Yeah, I call it National Drug Take Back Day.
Got it.
And that's sponsored.
Sponsored by whom? Uh-oh, Ashley, I
What
lost
were you saying?
I said I lost you for a minute. Who's it sponsored by?
I think it's sponsored through the DEA. The DEA.
Got it. So when we're talking about National Take Back Drug Day, it happened you said April 24th? Did you say April 24th?
Yes. You can go to their website, dea.takebackday.gov, April 24th from 10 a.m. to 2 p.m.
Got it. So,
and I also found a phone number if somebody does not have access to the internet.
Got it. So I think it's
That's 1-800-882-9539. Sorry, I think I'm cutting in and out.
no problem. Tell me that phone number again. We'll repeat it one more time for people.
Yeah, it's 1-800-882-9539.
Got it. And I was looking, takebackday.dea.gov is what I have. Is that right?
I tried it a couple of different ways, so it works that way, or the DEA.takebackday.
Got it. So if they Google Take Back Day, they can put in their zip code.
Yes.
And it will send them to the nearest place that has one of these drop boxes.
Yes. I searched quite a few different places. So the drop boxes are more common than I thought. A lot of pharmacies, CVS, independents will have a drop box. And then for the actual Take Back Day, it's going to be at the sheriff's department.
So 10 a.m. to 2 is coming up, sort of an official day. I think they do it in April and in October. So spring cleaning, April, get it ready. I really want people to understand, though, Dr. London, that even if it's not National Take Back Day, they can come by and bring tablets and capsules and such for the box at your store or other stores based on this. But there's one area that I think we haven't talked about. We talked about antibiotics, blood pressure meds, regular meds, but we all know in the news lately there's been so much discussion about the use of opioids or narcotics or pain meds. And I mean, come on, we've all had a surgery. We've all sprained an ankle. We've all been to the dentist and had something, done. And we've taken home a supply of medications that we probably didn't take all of. I would bet you right now in my cupboard, I have Tylenol number 3, which has codeine in it. I'll bet you money that there's some in my cupboard from a dental procedure I had done 2 years ago. Is this the perfect time, these take back days? Because these boxes are secure, right? They're locked up, they're looked at. So no one's going to steal out of that box if you drop a narcotic or opioid, or you're cleaning out the cupboard and getting rid of all that. Is that a fair question?
Yeah, that's true. And you're not going to get any trouble for taking it back. So, if you're cleaning out your grandmas who had pain medicine, you want to get rid of all that.
Got it. I was reading a statistic recently about teenagers. I have a nephew who is about 15 or 16, and it's not that he ever wants to do anything horrible, but when you open the cupboard and there's OxyContin there or morphine, as you point out, from grandparents, people who've survived cancer, it's a temptation for people. And there are other people who are already having trouble with opioids, and they can take that from someone's home, and they can steal it, which is difficult, but we know that does happen. This helps circumvent that, right? You're cleaning it out so there's no temptation there for anyone to sort of rifle through your cupboards and find these things, right?
Yeah, and most of the surveys say that the way drug abuse or misuse starts is from in the home. You're in the cabinet, you're borrowing a family or friend's medicine. You think that you hurt your shoulder, you want to try it, and that's how it starts. Yeah. So getting rid of that is going to prevent that misuse from happening.
Give me some examples of things that we should make sure they're cleaned out. Like if we're not using them and they're not actively being used every day, or something that we need to get through, what things should we be throwing out on National Take Back Day that gives us the opportunity to put it in a secured box?
Yeah. So you named the pain medication. So the oxycodones, the hydrocodones. The next biggest thing is probably, I consider it more of an anxiety medicine. So your benzodiazepines, which are your Xanax, your Valium. When you combine those with other medicines, they increase what they call respiratory depression. It can make you stop breathing. So even a small dose added to something else can really cause a problem.
Right. So diazepam, alprazolam, lorazepam, they all have Pam after their name, basically, right? That's the benzos. Yeah. Sleeping pills. If you're no longer using your sleeping pills, like Ambien, this is also a good time to get rid of it. Yeah, that's a good point. You mentioned overdose and sort of respiratory depression. Have you seen in the community an increase in this during the COVID? Because we've been sequestered. People have been through a lot mentally. Have the overdose deaths, have they gone up in our country? Are you seeing anything in Augusta and around that area?
I looked it up, and the CDC is reporting in the past year the highest number of overdose cases. The number I found was over 83,000 from July of 2020 to, or is that right? Ending last July. So it started before the pandemic, but during the pandemic, it significantly increased.
Oh, wow. Yeah. I had read some statistics like that as well. And, you read them on a national level, and I don't think we realize that it hits home, but the CDC tracks things like this state per state. So you can actually look up how your state is doing. And there's been a significant number of overdose deaths, especially like in the rural areas, farming communities, those kinds of places, because we're sequestered. There's a temptation. The drugs are there. And, I just,
Yeah.
I feel like we can avoid it, right?
Yeah. And I'll add another thing in there, which it just came up. Narcan, it's available in Georgia without a prescription. So if you or anyone has gotten into somebody's medicine and is having those side effects of respiratory depression, you think they may stop breathing, you can get Narcan at any pharmacy without a prescription. So
that's a great point.
Yeah.
We had Miss USA on, and she actually taught this. Her stance was Narcan. So we had her on in October. She did an entire show. So I'm going to do a shameless plug. Go back and look at the October podcast, and she'll tell you how to use the Narcan. But it's a really big, wonderful thing to add to the community because of this. But the other thing is clean out your cupboards and get rid of all this stuff on April 24th, National Take Back Day, right? Yeah. So whenever we're looking for this and we're sort of talking about what's out there, you talked about the phone number, talked about the webpage for them to find it. They put their zip code in. So there's multiple places. And then we sort of alluded to this earlier, but I want to make sure people hear us. So it's April 25th. I'm finally listening to Farmcast for the community, and I missed this entire podcast, and I've gone by National Take Back Day. Can I take back medications from my cupboard any time of the year?
Yeah, you just have to go to that same website and put in your zip code, and there's a way to see what pharmacies or locations can take back medicines.
So it's not like Christmas. You don't have to wait for it. You can plan around your time too, even though the 24th is the national day. You can do it anytime, right? Okay. All right.
Okay.
That's convenient. I love that.
Yeah. I was very surprised at how many pharmacies were listed. It's way easier than I imagined.
Okay. So what we've heard is National Take Back Day. Go to the website or just do Take Back. Let's see, Take Back Day. See if that gets you on your Google. What was that phone number again, Dr. London?
It's 1-800-882-9539.
And you can get rid of the medication in your cupboard you no longer need, including pain pills, benzodiazepines, sleeping pills, all those kinds of things that can lead to some temptation for people. And then also all the old stuff that you no longer use, like blood pressure medications you've been off of for a year because the new one's working better than the old one did. What about like insulin syringes and things like that? Can they get rid of those, or do those go in a different container?
Those cannot go back on drug take back either to the pharmacy or to sheriff. So those, they need to be discarded in a Sharps container safely. Something that can't be punctured. You want to keep that safe. And then liquids, I think I said before, can't go back. Illegal drugs that they listed, not to bring those back. But using kitty litter, coffee grounds, mixing it up so people don't get in your trash, and then getting rid of patient identifying information on the bottle before you throw it away.
That's smart. That's a good tip. I think, you talked earlier about coffee grounds. What we were told to do is open the bottle. If you can crush the pills, it's great. If you can't, soak them in some water and then pour them into the coffee grounds or pour them into the kitty litter. And you guys think we're crazy here, but people do go through garbage looking for some of these things. So that's a tip. And I love your idea of taking the label off the bottle or crushing the bottle so no one can see your name and the drug you take. I like that. I was telling friends of mine earlier, Dr. London, that letting someone get access to your medication profile is like reading your diary, because if we know what medication you're taking, for those in the know, we kind of know what diseases or things you're managing. And I don't know if everybody wants to know that. So your idea of ripping that label off is a smart one.
Yeah. I'm not sure where I picked it up, but I've stuck with it. And
no, I like it. It's again, we're back to what we talked about. If you can't make it to the take back box, this is a great way to get rid of that. I would tell you that even narcotics and things like that, you can do this too, but I would prefer you guys look for like a lockbox, a National Take Back Day, kind of a drop space. The other thing that sort of walking through the process and talking about this, ripping that label off and putting it around, is this, you talked about injections. If anybody's using like self-injection medications for their arthritis and things, they should be in a sharp box too, correct?
Yes.
Okay. All right. So just people have an idea of the differences that are out there and what they can do. I read somewhere that you should never flush your drugs down the toilet. And it contaminates the water, right?
Yeah, I mean, if it was one tablet, it probably wouldn't hurt, but it's much easier. You want to get it somewhere where people can't get to it, where it's safe.
Yeah, I
And there's
agree with
plenty of
you.
options.
I think that's smart. So we've talked about how great the places you work. I mean, they do a lot of different things. We talked about helping folks and vaccines, and then really we spent some time on Take Back Day. So we covered a lot. So if I had to ask you for like 3 pearls to give our listeners, what 3 things would you want them to leave our discussion with today?
Well, we talked about clean out and discard your medications at least once a year. Talk to your family, your friends about only taking medications prescribed for them or only that are given to them by a parent or adult. I think the biggest thing for me too is utilizing your pharmacist as a healthcare resource. Pharmacists love to talk to our patients, and we know all about the medicine. So don't be scared to go and talk to your pharmacist about your medicines.
That's a great. And then also, if you have any questions after this podcast about how to get rid of medications, you can ask your pharmacist about those kinds of things too. That's smart. Dr. London, anything else you want to leave our community with? You've covered a lot today, and we appreciate you being on.
Yeah, thank you for having me. This was out of my normal experiences, and I enjoyed it.
No, that's wonderful. Dr. Ashley London, who is the pharmacy manager at Barney's, which is a chain in Augusta, Georgia, and several of the areas surrounding that. She's joining us today, and she's talked about Take Back Day, which deals with getting your medications out of your cupboards, cleaning things up, and doing that spring cleaning. This year, that'll be April 24th from 10 a.m. to 2 p.m. Google Take Back Day, and you can find an area or a place to drop your medications off in a secure location, including pain meds and anti-anxiety meds and any kind of meds you want to get rid of. So next month, I'm bringing on Dr. Andrew Blake. He is going to talk about allergy medications. If you guys are like me, my car is yellow, my front door is yellow, everywhere there's pollen out there. So we're going to talk about Andrew and how he helps people in the pharmacy find medications to get them through the season. Until then, everyone, please be safe, be sane, and we'll see you again next month. Welcome once again, and thank you for listening to Pharmcast for the Community, sponsored by UGA's College of Pharmacy.